This conference is all about building aspirational healthcare. And I didn't come up with that. I learned that term from them. That's what they call their healthcare system. And let me just, I've said this a couple of times, I'll say it again. Traditional sick care is about building hospitals at the bottom of the cliff. I know, I opened 3 of them. I used to be a hospital administrator. I built those hospitals. I created those charge masters. I know what that's like to build a hospital at the bottom of the cliff. The more people that fall off, the happier I am as a hospital administrator. Well, the next level is let's build a fence at the top of the cliff. Let's create prevention so people don't fall off in the first place, which is amazing. We got to make sure that people are getting their screenings and their immunizations and whatever. But aspirational healthcare is even one step further. It's about building relationships so that you can actually journey along the path with the person so that they reach their destination, so that they accomplish their aspirations. And that only comes by building a relationship-based healthcare system wrapped around the customer. And that's what the best healthcare system in the world, the Nuka system of care by the South Central Foundation, has created. Monica and Karen are 2 people I got to hear their stories when I was in Alaska in June. Yeah. I asked them both while I was there, I said, would you be willing to be a part of this year's conference and just share your stories? I think that would be so incredible for people across America to hear what their system is built and their own story having lived through it. So let me just kind of set the stage. As I went through and learned how this amazing healthcare system keeps relationship top of mind, I got to go through, as a part of the conference that they hold, and everyone can go, it's a wonderful conference, I recommend it to everybody. They literally take you through the very same core concepts training that every employee, every person in the South Central system goes through, which is called Core Concepts. And it's a 3-day masterclass in building relationship of trust. And it's all about how to create the environment for people to share their story and then how to respond to their story in a way that builds trust. Talk a little bit about, you don't just train the doctors in Core Concepts. You don't just train the nurses in Core Concepts. Everybody, from housekeeper to administrative assistant, everyone learns the core concepts and the importance of relationship. How critical is that to the overall system working in a relationship-based healthcare system?
Yeah, maybe I can start with that, and Monica can add in as an operational director. I think that it's very critical to who we are as an organization that everybody is speaking the same language. And part of what Core Concepts does is teach communication skills and the expectation for employees to share story and to be able to respond to story, not only with our coworkers, but also with the community. And it needs to be reinforced and relearned sometimes. But we're all starting from that same place where the importance for our community and our culture is that sharing of story to be able to continue, that throughout every interaction.
Nice.
Incredible.
Yeah. And I think just kind of piggybacking off of that, it just becomes a culture here. Everybody does it. And a majority of our workforce is customer owners, and they come on campus to get their service. So they understand the story and the purpose of why we're here. And so it's just a culture that just kind of grows from itself.
And there's no better way to really help you understand what that looks like than to maybe just let them share their story. And I would just tell you that one of the beautiful things about their culture is this connection to heritage and their connection to their people. I love how every time one of the folks introduces themselves, it's not just about me and who I am, it's about what family I'm tied to, where I'm from, my parents, my heritage. I love that.
The healthcare system is really what changed it for him. And today, being in operations, it's amazing because I get to sit with all of the different clinics. I talk about the story and the history of Alaska Native people and what they need, and how do we make sure that we're providing that for our community, and how are we bridging that? So we have a detox center. The detox center, how do you partner with our primary care center or the emergency room? If somebody comes in, how are we partnering with primary care to make sure the healthcare is being maintained? And it's not just a encounter, and it's just not a number coming through the door. It's a human that has a story, and there's a reason why they're coming here, and there is a way that we're able to support them by sharing story, understanding their story.
So who would like to address the issue of, once a person has told their story, what's the appropriate way to respond to build trust? Because I love that part of your training.
I was having a hard time not responding to Karen's story, and I think for us, it comes so naturally. And the way that you approach it, the way I feel is, it's a gift that someone is sharing with you. It is a gift that they are sharing their story and why they present themselves who they are today, and why they get up every day and they're motivated to do different things. And so it's a gift, and just acknowledging pieces of their story and acknowledging that how they must have felt going through that. And so and just celebrating, I guess, I just have to say, celebrating the story and being there for somebody, but not to the point where you're asking questions. Don't ask questions. It's a gift that somebody gives you, and being sure that you're able to just be respectful to what they just shared with you.
I also found it hard when she shared her story not to respond, right? Because it comes so naturally when, you practice and you hear people's story. I typically share, when I respond to story, how it is a gift and how we are blessed to hear it, and how, it touched me. And I think everybody wants to be connected, and one of the ways that people connect is through story. So being able to hear people's story, find those connections and build on them, builds trust over time.
The provider has a relationship with a customer owner that comes through. They build that relationship by understanding the family history. Where do they live? How many kids do they have? What do they enjoy doing? Understanding, like, this time of the year, I enjoy going berry picking or fishing. And then from there, just getting more details and more information out. This is the same primary care provider that they're going to see throughout their healthcare journey. And so with that, it's not just it's very helpful for a provider to understand and get to know them, of who are they serving, who's the customer owner, and how can we best serve them. And then also understanding from the integrated care team perspective, who can come in and help support for the care plan for this customer owner. And so in some of the specialty clinics, it's a little bit different because they serve a lot of the customer owners that are in the villages. And so creating a relationship with a customer owner and making sure that they're staying in touch with them, but also building a relationship with the village providers as well, to understand what is going on, how can we keep supporting, and then also understanding what resources do we have in the community to help support the customer owner. So it's not just about the cold that they're coming in to see us for, but it's for the overall healthcare journey that they're going through, and then resources, whether it's getting a car ride to their appointment and making sure that they're coming to their appointment because they have a car or transportation to get here. And if they don't, how can we support them in that piece of it? So looking at the whole healthcare journey and supporting them in that sense.
So I think, if you were to move to Alaska and be a customer owner and be Alaska Native or American Indian and want to be seen by our primary care team, first you would have to select who you want to be in relationship with. So we have a process called empanelment, where we have a picture of the provider and not only their credentials and where they've gone to school and what they've done, but also personal things about them. They're married. They've lived in Alaska for 12 years. They have 2 cats, all of the things that they like to do as well. And that allows individuals an opportunity to select who they want to be in relationship with. So once that selection process has happened and our whole family has moved to the community, and now we're going to select Steve Steve, for example, to be our primary care provider, we have an opportunity to, for myself, since Steve has been our provider, when I was pregnant with my children, there was a conversation about, hey, you're going to have 2 kids, they're healthy, who would you like them to be in relationship with? And at that time, Steve became their primary care provider right at the time of, after delivery, and we got to select who. And even now, if, my sister moved here, there would be an opportunity for families to be seen together and all have the same primary care provider. I think, for me as a parent, it was especially important, right? The reason why it was important is because we could come all at the same time, right? It was easy for me, a working mother, to be able to come as a family to the same place, see the same provider, and have appointments back to back for my baby appointments, as well as they grew up, their sports physical. But also my health care and part of my concerns about my health, whether it be, pre-diabetes or high blood pressure, are going to be those same concerns that my kids could have if they don't take care of their health, right? So the idea of we all have the same story, we know what resources we have at home, we know what resources we have as a family to be able to support people in choosing a healthy lifestyle, makes it very easy for those transition and those conversations to happen. So ongoing, we ask employees if they feel comfortable as part of our employee engagement survey every year, sharing part of their story with their team or their leadership, and we monitor that. We also ask if people participate in core concepts and if they hear their manager or supervisor using the tools from core concepts in their day-to-day interactions. So we kind of have some data associated with how well people are continuing to practice the tools and that they've learned in core concepts, as well as we provide core concepts, especially during COVID when we were mostly remote, where we would have refreshers, where we would have a Nuka minute or a core concepts refresher that was just a couple, maybe 3 minutes, so people can be reminded of the importance of the communication tools that we teach as part of the class.